My name is Brittney Moutray. I'm a dietitian here at IVCH, and it is November, so November is American Diabetes Month. So I think that, we really wanted to just bring awareness to our community on the things that can really help you if you have diabetes, or even if you're trying to prevent diabetes, which I think is, a lot of people. So we've got some wonderful resources here in the Illinois Valley that we'd love to tell you about today as we celebrate November, which is Diabetes Month. So Deb's here as well, and we will introduce ourselves really quickly so you kind of get to know us a little bit. And again, my name is Brittney Moutray. I am a registered dietitian here at the hospital. I've been here almost 6 years now, and during that 6 years, I've actually become a certified diabetes educator. So we've gone through lots of training and experience with educating those with diabetes, and passed a pretty difficult exam there, so it's very, I feel very empowered to help people, in our community with diabetes, so that I think that's a wonderful thing. One of my favorite things that I do here at the hospital is teach classes for diabetes and help those with diabetes, empowering the patient to, you as the patient to, lead a healthy lifestyle to manage your diabetes. So that's a little bit about me, and I'll let Deb introduce herself as well.
And I am Deb Redd. I am a registered nurse and a certified diabetes educator. I am a lifer here at IVCH. I have been here for 44 years, and almost all of that time I have been a registered nurse. I have been a diabetes educator since 1992, and then passed that same horrible exam that Brittney talked about in 1998, and I've been a certified diabetes educator since that time. We have a great partnership, and I think it's always important to know that when you have diabetes or prediabetes, the services that your dietitian and your nurse educator can offer you are different but very complementary, and both very important to helping you maintain control of your diabetes. So I think with that, we're probably going to let you know what some of our services are. We thought that since this is also, besides being Diabetes Month, it is also, this first week is Diabetes Educator Week, so we thought you might like to meet the diabetes educators here at IVCH and learn a little bit about what we do and what we can offer you.
Right, exactly. And for a smaller hospital, I get goosebumps every time I think about all the services that we do offer as a diabetes program. It's pretty amazing. We offer the traditional group classes that, a lot of centers might offer. So that is a group, not a huge group. I think it's a perfectly sized group. It's usually about 3 to 6 people in the group, and it's more of a discussion or a conversation about diabetes and how to manage. So it's not a lecture-based approach. It's a really great, comprehensive discussion, really, and you learn a lot about diabetes management in a practical way. So we have group classes just about every month of the year, and we offer morning and evening classes to suit all different types of schedules. So almost every week of the month of the year, we're offering diabetes education classes. If that's not your thing, if you don't really, think that group approach is right for you, we also offer one-on-one education with an educator. So that is a nurse educator and or a dietitian. So again, kind of a comprehensive approach there. We talk about different but complementary things, as far as education. So group education, individual education, and then tons of other services as well. So I'll let Deb kind of talk about that now.
So now you're going to have to be careful, because I get really excited in the things that I talk about. I love what I do, and I love helping people figure out how to, I think we both do, love figuring out how to help people problem solve and work through some daily challenges. So some of the services that we offer besides our group and individual education, we are a pump training center. So if you've ever entertained the idea of using an insulin pump to manage your diabetes, we can help you out with that. We even have an initial appointment called a pump inquiry, where there is actually no charge for that appointment. You can come in and meet with us and we'll show you, we work with 3 different pump companies, and we can show you those pumps and talk to you a little bit about what pump therapy is all about, how it can help improve your diabetes control, and then we can help you make that application so that if you would like to proceed with starting on insulin pump therapy, we can get you started with that. As time goes on, after you start using your insulin pump, we can also work with you and your provider so that you can get the very best results with your pump therapy. It takes a little bit of tweaking. It's not something magical that happens right from the start, so we like to form a nice, strong bond with you and have you come back and see us fairly frequently for a little while, and then once you're good to go, we take off the training wheels and you can go out on your own and work with your insulin pump. But we're always here to help you out, make adjustments to your settings, things like that. So that's one option. And we, like I said, we do work with 3 different pump companies, and so that affords a lot of different options to you as far as deciding what you would like to do and which pump you would like to use. And there's a lot of exciting technology that's available now with some of the newer pumps. It's pretty amazing what they can do for anybody who has diabetes. And just so that you know, in general, insulin pump therapy is covered by Medicare, Medicaid, and most commercial insurance plans. So if you want to do pump therapy, there's a pretty good possibility that you can. I also do something that has really just kind of taken off. I'm sure that you have seen the commercials on TV because everyone is calling our center now to ask about that insulin or blood glucose monitor that you don't have to stick your fingers with, and people have been asking for that for a very long time. So that is actually something called a CGM, and that stands for continuous glucose monitoring. And it allows you to see patterns in your blood sugars 24 hours around the clock. And it is available in really 2 different ways. There are personal CGM systems that are available for people to use in their everyday life. And then there's also a diagnostic CGM, which is something that we do and have done here at IVCH dating all the way back to 2006. And that lets you and your doctor make better decisions about what type of treatment plan you might need to move to, or if you just need to tweak your current treatment plan. It lets you and your doctor make better decisions about that, better informed decisions about what to do next. In either case, it allows you to see your blood sugar, as I mentioned, 24 hours around the clock, which is something that you could never do just by doing simple finger sticks. So we're really excited about that, and I think that on a personal level, the sensor use in everyday life is really just going to take off. I think everybody is interested in it. The doctors are using it more and more to help them assist their patients with treatment decisions, and it's just a very exciting thing. There's actually a new term that's out there that we just talked about in a meeting yesterday, and it's called AGP. Mm-hmm. And if you're wondering what that is, it stands for ambulatory glucose profile. And that means not just looking at what your blood sugar is at one moment in time, but looking at it over a period of time to see what your actual profile is, to see how much variability there is in your glucose levels, mm-hmm. and to help you make better decisions based on that. So we're really excited about that. We also offer a diabetes health clinic here, and typically we offer that once a month. I'd like for you to think of it as maybe a one-stop shop to get everything that you need done to assess your diabetes. We offer, part of that health clinic is a retina photograph, which is then read by a licensed ophthalmologist, and the report is sent to your physician. One of the things that we should all do if we have diabetes is an annual dilated eye exam, but sometimes people just aren't able to do that. And sometimes there's a little confusion about what that eye exam is actually for. It really has nothing to do with whether you need to have your lens prescription changed for your eyeglasses. It has to do with looking at the back of the eye, which is the retina, and we focus on that in diabetes to try to prevent any chronic complications. So we're looking at something different than when you get your eyeglass prescription. So it's very important to get that done on an annual basis, and this offers a little bit quicker way to get that done for sure. It doesn't involve sitting in a doctor's office, and not that that's a bad thing. I don't want to throw any doctors under the bus, but sometimes to spend time in a waiting room and get your eyes dilated takes up a lot of time in the course of a day. So this, if we're very, very fortunate with the photography, takes only about 5 to 10 minutes, and you are in and out from the photography, and we do not dilate your eyes in most cases. Occasionally we have to get an order from your doctor and do dilating drops, but most of the time it can be accomplished just by having you come in and sit in a dark room for 5 minutes, and then we snap the photos and you're in and out. Another part of that diabetes health clinic is an opportunity for 30 minutes of education about the chronic complications that can result from diabetes. Just a little short educational session to let you know why we're doing all these things and why we recommend the tests and the exams that we do. And then third, and certainly not last, we offer a chance to have your lab work drawn at the same time. You can have your annual lab work done at the same time that you come for the education and the retina photo. So it gives you the opportunity to get everything done at the same time. And we just started that a little over a year ago. I will tell you that if you are not available on the date that we normally hold the clinic, we can make additional arrangements for you to come when it's convenient for you. You just need to let us know that.
So as you can see, there's lots of things that we do, and I have to say, this lady right here is so intelligent, and I look up to her so much, when it comes to this kind of stuff, or anything really. I've learned so much from her, and she's obviously, with 44 years here, has a ton of experience, so
it also means that I'm an old lady.
No, not at all. She is wonderful. So we offer all of those things, but there's more. We also offer a diabetes prevention program. So not only, do we offer all of those programs and services if you already have diabetes, but preventing diabetes, and really everyone is at risk for diabetes. There's some certain risk factors, yes, but some people are more at risk than others, and we offer a program. It's really a year-long program with education and support led by certified lifestyle coaches. We actually have 6 of us that are certified lifestyle coaches, so that's pretty cool. We're real go-getters here at IVCH. We have, again, lots of things that we offer, but it's a great weekly program, with education and support as far as preventing, giving you the tools that you need and education that you need to prevent diabetes. You can really cut your diabetes risk in half, and research shows that this program works. It's a proven lifestyle change program. And there's a couple characteristics or goals that they have for us, and that is losing 5 to 7% of your body weight. That has been shown in studies to, again, help prevent diabetes, and also getting enough activity, 150 minutes a week at minimum. So that's really broken down to about 30 minutes 5 times a day. You could think of it that way. and then again, losing 5 to 7% of body weight. So I actually have to share with you our current cohort or current group of participants has definitely met that goal. So 6.7% of weight loss. That was their overall number, that they met that goal basically. So that's pretty cool. We're helping people in our community prevent diabetes through this proven program. So I love that. So if you're interested in that, let us know. We can definitely help you out. So it's really just a healthy lifestyle change program.
With proven results. So I want to kind of close by saying that the mission for our diabetes wellness program here is to empower the people who come to see us, whether they have prediabetes or type 1 or type 2 or gestational.
Mm-hmm.
We didn't mention gestational diabetes, but we work with women who have developed diabetes during pregnancy, which is a fairly common occurrence too. So no matter what type of diabetes or prediabetes you have, we want to empower you to be able to self-manage your diabetes so that you can lead a really long and healthy life. And we feel very strongly, and I think we're probably both pretty passionate about this, that I always tell my patients diabetes is a team sport. So what I mean by that is that it's not just you with the diabetes, it's all of the people who love you and who surround you. It's your healthcare provider, your pharmacist, hopefully us here at the Diabetes Center. We're all part of your team, and we would love to have that partnership with anyone who needs to have our services. So if you're interested in any of the services that Brittney and I just talked about, we would love for you to contact our program assistant. You'll love her too. Her name is Sandy. She'll make you feel very welcome. And her phone number is 815-780-3576. She's typically here Monday through Thursday from 7 a.m. to 1:30. And however, you can leave a message and she'll be happy to call you back. If you don't feel comfortable contacting your provider to ask to come and participate in our services, we can do that for you, or you can choose to talk to your healthcare provider on your next appointment, and then that he or she will send us a referral. All of our services do require a physician's referral. Not all of them have a charge, but we still need to have a referral from your provider. So if you're interested in that, we hope to hear from you soon. And I think that's all we have to say. So thanks for joining us today.
Thanks, guys.